Welcome, everybody. We'll be getting started here in a few minutes. We'll give a few moments to allow people to get logged in. For those just joining, I'll get started here at about 12:03. Allow everybody to get logged in. Right. Well, we'll go ahead and get started. I know more will be joining here shortly, but welcome everybody to the September session of Frontiers Research and Discovery Grand Rounds. Super excited to sponsor the Research and Discovery Grand Rounds as part of the membership opportunities through Frontiers. There's multitude of resources and opportunities through Frontiers, so we encourage you to go to frontiersctsi.org to learn more and register to be a member. And then we would like to also highlight next month's session for October. Save the date for Thursday, October 24th from noon to 1. We're going to be hosting Hanlin Kuo from Frontiers Recruitment and Network Navigator. He'll be presenting on the recruitment resources and accrual prediction opportunities. So look forward to that session and have everybody join. So with that, I'm super excited to introduce this month's session. We're going to be we're going to be inviting members of the COPE program, otherwise known as Communities Organizing to Promote Equity. They're going to be presenting a segment from the documentary film called Lifelines of Care, Kansas Community Health Workers Making a Difference. Super excited. This session is going to be led by Ton Maris, Community Healthcare Work Project Manager at the University of Kansas Medical Center. His extensive experience in serving our communities include developing and implementing community healthcare worker programs in hospitals, clinics, and community-based organizations, and training over 60 community healthcare workers across Kansas through the COPE project. Please join us following the screening of the documentary. We're going to be joined by Christina Bridges and Christina Pacheco for a panel discussion. They're going to give insights on community barriers, implementation, and positive outcomes through these programs. So with that, I warmly welcome Tom Maras.
Jamie and Ashley, thank you so much. And thank you, Frontiers, for giving us this opportunity to do the screening of the community health worker film. This has been an initiative that we created because it's very important to pass the word about what community health workers are doing in the community and the great impact that they are having in terms of like health and social needs in the community. So community health workers have been embedded with clinics and community-based organizations, FQHCs, hospitals, and we are within the first 5 states in the country in terms of initiatives with community health workers. So I'm going to share my screen real quick. So when we think of this documentary, the need of this documentary happened not now, but 10 years ago when we saw community health workers doing the impact in the community and helping individuals, but also families and community at large. And so why do we want to create a documentary? And there are 4 main reasons. The first one is raising awareness, what we are doing right now. We might have providers, we might have nurses, social workers, and other professionals writing here that might be wondering what even a community health worker is and how can they, implement them with their practice. So just making sure that everybody knows that a CSW can just work beyond the 4 walls of the hospital or the clinics and come back and give you the input, that feedback from the clients, and just to get better health. Then the demonstrating the impact, and we are doing this through data. We're gathering a lot of data on the impact of the community health workers, and we have been writing some papers about it, and some other papers will be coming sometime soon in terms of outcomes of community health workers in Kansas. But then strengthening community support and also supporting policy advancement. Currently, we are working closely with Medicaid to ensure that Medicaid reimbursement is happening for community health workers and to improve everything that has been done in terms of policy and reimbursement. Medicare is also doing reimbursement for community health workers at this point. We had a meeting yesterday where we are advocating for hospitals, emergency rooms, and specialty care to be able to reimburse for the services of CSWs. And the conversation is taking a really positive turn. And last but not least, I just wanted to give like an overall real quick about what happened with the CSW. So in 2010, through the Affordable Care Act, the community health worker was recognized as a profession. And at this point, community health workers began to do assessments in the community through clinics, through community-based organizations. But that was not enough. We needed to implement more CSWs in the community. And this is where many emerging CSW programs have been raising, not just in Kansas, but in most of the states across the country. And then here in Kansas, we created an education and certification for community health workers that at this point, to get reimbursed by Medicaid, they will have to have that certification completed. And last but not least, as I said before, CSW outcomes is going to be the proof that this is working, that this is going to be helpful for providers, but it's also going to be helpful for those folks in the community that are currently struggling, and that we can help them and just get them in better health. So with that said, I am just going to share my screen again and share the documentary.
Where do I start with this story? I guess I just have to stop and think about how blessed I've been. Because I was raised on a farm, grew up on a farm, and had the opportunity to live in rural Kansas all my life. And I can remember when I was 21, married 1 year, the temptation was to leave the farm life, but I looked out across the wheat field as the wheat was just coming up in the fall. And I thought, how blessed I am. I can see green wheat coming up out of the ground, and I thought, I'm staying. Lived longer than what I thought I would. And now I'm faced with some problems that I've never faced before. As we prepare for our old age and the limits of our body, and we just got to stop and think about all these things. Sometimes we need help, and sometimes we don't know where to turn to find that help. And it's not just necessarily us who live in the rural area, but city people have the same problem too. There are city people that needs help, not just us rural people. And I know that there's places and things out there and people that can help. We just don't know where to look for it. I'm sure the help's out there.
Hello, my name is Tom Meraz. My focus is working and training community health workers and having them implemented across the community to address needs of folks in the community who are struggling. Community health workers are advocates of health and well-being. There are folks that are in the community that they were born and raised in those communities. They really know the ins and outs. Everybody in those communities look up to them to look for help, to get them for advice. Community health workers are able to empathize with the clients that they serve. They put themselves on the shoes of their clients, and they really understand what they are going through because their experiences in the past reflect that. They have been going through exactly the same thing that the clients are going through. Some of them have diabetes like their clients, some of them are immigrants like their clients, and they struggle with the process of getting to the United States. So community health workers also are the liaison between the client, the health system, and also the social system. They are connectors. They are very knowledgeable about the resources that are out there in the community. They are able to connect the client to a service in a heartbeat. Off the top of their head, they are going to know the resources that are there. And if they don't know those resources, the community health workers are going to be holding the hand of the client to be able to take them to that resource and learn with them.
For me, a community health worker is working and living in the community in which I serve, to be an advocate for those that otherwise wouldn't have a voice or even know where resources were to help them in times of need.
To me, a community health worker is a built-in best friend / mama bear. As a CHW, I can be that motivator to be like, okay, well, let's go, I'll do this with you. Some people, they have anxiety, they don't want to do things by themselves, and I'll go with you, I'll hold your hand. You want me to help you with this paperwork and go turn this in? All right, let's go turn this in together. A community health worker will help guide you and teach you so then you can do all these things on your own.
The community health worker, from my perspective, is a worker that meets with an individual or family to assess their needs and then connect them to resources within the community.
I feel like in 2010, there was a huge difference as to raising the movement of community health workers. What happened is, at a national level, there was an agreement of defining the role of community health worker.
In 2010, the community health worker actually got the job code assigned to them under the Affordable Care Act.
Starting with the Affordable Care Act, which really created a lot of opportunities for community health workers by creating new payment options and recognition of the profession from a Medicaid standpoint. I think there became a lot of opportunities to pursue community health worker policy, not just in Kansas, but across the country.
When we developed the curriculum, we also wanted it to be a standard curriculum, because when we talk about certification, we talk about standards in the healthcare system. We also want to make sure that it is common knowledge that will help people to better a community.
The conversation that was happening at that moment was very important, because it was not only decide what kind of training or curriculum we needed, addressing the core competencies of the CSWs, but also because CSWs need it. Everybody needs to know how to perform. Many of them are great volunteers from the community, but they are not tied to a schedule or to a job responsibility. They are doing this because it comes out of their heart.
At the end of the training, the certification is so important. It really is, because it gives you a sense of completion, that I have learned what was required that can help meet the needs of my clients. I have a pretty much good grasp on that, and also in the community itself, how you're represented, how you present yourself, how you looked at. You are a professional, a certified professional, and you conduct yourself accordingly.
Casey, why don't you introduce yourself?
Okay, my name is Crescence. I go by Casey. I am Crawford County COPE community health worker.
So community health workers get their clients in a variety of ways. Medical based, it's usually because they're clients that are coming in or are patients, or they're an internal referral from another medical department.
I'm Dr. Hudson. I'm an adult internist and a pediatrician, but I see predominantly adult internal medicine patients on a day-to-day basis. We're managing around 20 people a day. Some of them are well managed and some of them are not well managed. And a lot of them have other adversities, including whatever their socioeconomic status is, which tends to contribute to their healthcare issues.
On the other side of town, there's a family living without bed sheets, or they don't have toilet paper, or they don't know if they're gonna have food the next day.
If there's a need for hunger, if there's a need for food assistance, there's likely, just like anything else with the social determinants of health, it's likely we could also be having conversations around financial stability, employment, healthcare access, treatment, substance use, childcare, transportation, right? Really using this opportunity as one to start the conversation. And what we know is so valuable about the community health worker role, but is building relationships and connecting with people where they're at, meeting them where they are.
My job is to go out and find them, make myself visible in the community by going to the bus terminal at times, sometimes sitting in the library, sometimes just going to the store. Every time I go to a Wendy's, for example, a local restaurant or something, I see an opportunity sometime to help someone, to give them my card and tell them something about what we can do to help support them.
I was on drugs and alcohol, but Felicia has helped me. I'm now in voc rehab. I'm having an appointment for my Social Security that she helped me with. She helping me with the Shelter Care Plus or whatever, so I won't be homeless. And just pretty much pushing me forward to do positive. Don't let the drinking get me down. I haven't went back. I'm 87 days sober today. So I'm just here to try to do what I can to stay sober and get my own.
With this role, I've got a free, open mind to, one, be myself, but also be what these people need specifically. Some people, they aren't really talkative and they just want my presence there. Other people, I know their whole entire life story, and I know about their Aunt Jan from 10 years ago. And it's just, each person is different. And in this role, you have to be able to adapt and adjust yourself according to each of these clients, because they're not all the same and they all need different things.
I first came here to Pittsburgh about, actually Kansas, about 3.5, 4 years ago. I moved from Washington. I was heavily into drugs and stuff like that out there and getting myself into a lot of trouble. And a family member of mine lives out here and asked me to move out here to see if I couldn't straighten myself up. And so I came out here and I found that it was just as easy to get drugs and alcohol or whatever here as it was there.
It was around April 1st, and I thought it was a joke. They told me that I had a mass in my lung, right lung, and it got bigger. And then they started talking about cancer, treating it like it was cancer. And so I quit smoking after 45 years, like that. And they started setting me up with different scans and talking about chemo, and I thought, wow, my life is just gone to hell.
I ended up in the hospital several times, almost dead. The last time actually on life support, and for 11 days, didn't think I was gonna make it.
Going through the chemo wasn't as bad as I thought it was gonna be, and then I had to start going to get checkups down in Joplin, and that's when Casey come into the picture.
I was actually in the hospital and getting ready to get released. This woman on the other line says, you know, my name's Casey, and I've been trying to get a hold of you several times by text and by phone calls, and you don't return my calls or anything. Do you really need help? That's when I knew that it was either keep going and kill myself, or try to do something to better myself and be there for the people that I still have. So it's like, you know what, let's give this a shot.
Our community health worker, Julie Foster, she is the perfect example of a community health worker. One of the things that I have seen and I have witnessed Julie doing is to put together all these events where she's tackling and addressing the needs of the community at large, and not only just individual needs. And so that's something that is magical, and it is something that's gotta happen in every single community, where community health workers have the ability to think outside of the box to ensure that those needs or the struggles that are happening in the community that can be tackled by the efforts of the community health workers.
I have been doing community health work unofficially for a long time. Once you get to realize what it is and what they do, I had been doing it since I was a little girl. I was born in Chihuahua, Mexico, and I moved to California when I was probably about 7 years old. That was a huge change. You know, I didn't know the language. I was obviously an immigrant. When we moved to Kansas, which I didn't even know Kansas was, I was in for a shocker. You know, I had never seen flatland. I had never felt the cold like I did. It was a total culture shock for me. For my personal experience, how my mom was, she wasn't involved in getting to know the culture or creating a community. Her responsibility was taking care of me. I'm gonna pay the bills, and that's it. And so then it was my responsibility, felt like, to learn the new culture, adjust to the United States, and learn the language. And so with that came the responsibility of, you know, ordering our food at a restaurant, or translating for my mom at the store, figuring out where the next bus stop was gonna be. And so those are a lot of things that now as a community health worker, I find myself doing. How are you gonna take the bus? Where's the bus stop? Where do you need to go? How do you get a bus pass? And so those are the things that I was doing at 8 or 9 years old that I'm now doing at 35, but now it's a career. I work with people that need that same support system that my mom did. And then we have information as to what is a CHW, what do we do? As a community health worker, I think some of the skills that are important to have are having that trust between the community partners and members, because it just goes in a circle. If there's a community member here and there's a partner agency here, but there's not that community health worker that has that trust or that relationship built, it's not going to work correctly. So I think when you have somebody that has those partnerships, that has that relationship, that knows the community, it is just such a vital skill for them to have. And you don't You don't want to handhold them through the whole, because they need to become self-sufficient. And the only way that you become self-sufficient is to learn to do it on your own. And through some of those phases, you do need support, and that's what we're here for. But I eventually would love to see that person that I'm helping pick up the phone and make that call themselves, or say, hey, I was able to get a food box on my own, but I was there at the beginning teaching that person to do those things. So to me, it's really important that whoever I'm helping becomes self-sufficient, because I'm a phone call away, but I won't always be a phone call away, and somebody else might not be a phone call away. So it's really important that not only do I provide our families with the resources they need, but I teach them how to access those resources.
You know, we've made a lot of memories in this house. Been my home for a long time. I raised my family here. My memories are here. I want to stay here as long as I possibly can. But I'm alone. And I know it gets harder. I'm fortunate. I have a home here. There's people in the city that prices are so high that they can't afford the housing. We think about the homeless people that's in these cities. Something's just got to change.
What is challenging and difficult for our clients here is housing. The access to housing, to affordable housing to be specific, and also housing that is of a standard of living, a good standard of living.
It seemed like you can get in quicker, get you a tent and a sleeping bag. Who wants to sleep in a tent and a sleeping bag in the tent community with all that going on? No, no.
We have a huge housing issue, and I know we're not alone in that. It is very difficult to find housing for individuals who are unhoused. It's very difficult to find affordable housing, period.
I've lived here in about 8 different houses, and each one it took me months to find.
Many clients come to talk to the community health workers when they have lost housing. Housing has been a big challenge here in Kansas and across the nation, where many of the clients that the community health workers are working with have lost housing because they've lost their job first, and so situations like that escalate to a point where in one day a family or an individual has no longer a place to stay or to live, and that leaves them with a huge insecurity. When they come to our community health workers and they talk to them and they are looking for immediate housing, community health workers are able to connect them to shelters in the community. But sometimes that's not enough. There are many of the clients that have been discharged from a hospital and they have specific conditions that will prevent them from being in a shelter. There are sometimes families that would like to remain together, and a shelter might not allow that. They might have to separate families by gender. So that has been a little bit of a challenge for community health workers, and yet they thrive and they find the right resources for those families.
We know that a lot of the issues surrounding homelessness have to do with readily available and affordable, safe housing. You can go through the entire process to get a voucher, but if there's not a house available for you to attach that voucher to, you're stuck.
I'm still trying. I'm like 1,000 somebody on the list. And I just basically been staying here and there, and I'm getting too old for that. I just want my own.
Healthcare, that's something that's so important. I've already realized the importance of it as I went through life and provided for my family the insurance and coverage that they needed. And we had the cost of the premiums, and lots of times we would go to the doctor and there would still be a bill after the insurance was paid. It seemed like a never-ending cycle as we went through life. But boy, there were so many questions. There's so many people that need answers as far as their health care is concerned, where we can get good answers and understand what's in a policy and what's covered and what's not. And sometimes it's just confusing, and it doesn't change as we get older. It's still confusing, and we still need help.
And this is always going to be there until we have a better healthcare infrastructure system in our country, is being able to access affordable care that is, one, not only adequate for what they need, that is close to where they live, that provides wraparound services, but that is also culturally competent for that individual.
As we looked at the landscape of healthcare in Kansas in 2019, we realized that we could improve access to care and improve patient experience by looking at innovative solutions like community health workers.
You know, we all get into the doctor's office and maybe we forget a couple of questions to ask, or we weren't really sure why we were making this change on a medication. That community health worker can help close that gap, not only for the patient, but also for the provider. The provider can better understand what might be impacting a patient in their life and their ability to actually follow through with a treatment plan. We see that a lot with medications, and and even in the clinics, especially federally qualified health centers are encouraged to ask questions about, are you eating 3 meals a day? Can you get to the appointments? Can you get to work? Can you get to the basic services and needs you have every day? We're asking a lot of questions like that for data, of course. Community health workers allow us to respond to that data, allow us to do something when a patient shares, I'm not eating 3 meals a day. So that doctor might say, well, shoot, I can't, prescribe this diabetic medication the way I would want because I've got to adjust. Well, now that doctor can say, you know what, I'm going to get you connected with a community health worker so that way we can make sure you're getting the nutrition you need, and then maybe even provide some nutrition education. So it's not only about the medication, but it's also about a nutrient-rich diet that's going to support their conditions. And the community health worker can help close those gaps.
There are things that I'm able to better care for my patients because they're doing their job above and beyond what I would ever imagine. I can't do my job here without them, to be honest. I rely on them every day for all of our patient care needs.
Well, getting around is another thing that we have to be concerned about, or I have to be concerned about. I've always been blessed. I could get in my vehicle and I could head to town anytime I wanted to. But I come to realization not too long back when I was asked, do I have someone to take me where I need to go when I get to the point that I can't drive? There's people that doesn't have family and maybe not have friends that are able to drive, that can take them places. They have to depend upon somebody or some group or something to get them to the grocery store or get them to the doctor or get them to the hospital. Transportation's important. It's just a thing that I've taken for granted, but I might not be able to do that forever. It may be a time coming, and probably is.
They're offering to drive them to appointments, or they are now our transportation system, perhaps, that is taking them from their house to an appointment or even to a specialist, or they're taking their prescription medications out to them. They do so much.
You would think that we would have more high-end medical facilities, but we don't. So most people here, they're not able to drive 30 minutes, 45 minutes to Joplin to the bigger medical facilities for a lot of their procedures. And most of the elderly people, they go for weekly checkups or weekly visits for some medical issues that are very needed to go every week and they can't afford the gas to get there because it's so expensive nowadays, or their vehicle just won't make it, or they just can't drive anymore due to this medical condition. So a lot of things that I help people with in this community is transportation to those medical appointments.
Going through the chemo wasn't as bad as I thought it was going to be, and then I had to start going to get checkups down in Joplin, and that's when Casey come into the picture, and she picked me up and she'd take me down for the long distance drives, and we did a lot of talking, and she's easy to get along with and settles you down for what might happen. You know, she's got pretty good background in what's going on with all this, and she tells you about it long before you get there because it's an hour-long drive.
Another skill that I think everybody should have when it comes to being a CHW is just not being judgmental. You can't judge these people based off of the position that they're in, because sometimes it takes one missed paycheck for you to be in their situation, or just losing a job unexpectedly when you're really struggling, and now you're in these situations. And some of these people, they didn't grow up in a certain family, or they weren't taught certain things, and they just need that friend to sit there and listen to them and not judge them and help them get the help that they need.
Crescence is our community health worker in Pittsburgh, Kansas. She is a spark of light for her clients. When she's interacting with the clients, you can see her face. You can see how the clients are in sync with her all the time. Crescence had also her struggles in her life, and that's what makes her relatable to the clients that she's serving.
I was born in North Carolina. I was born in Jacksonville on the military base. My dad is a Marine. And I lived in Harlan, Iowa my middle school years. And then my freshman year of high school, we moved to Pittsburgh, Kansas, the wonderful Pittsburgh. In 2018, I was in a motor vehicle accident down in Grove, Oklahoma. I had overcorrected on a curve after I was hydroplaning and went off a cliff. And I was stuck in my car for 2.5 hours before they could get me out. Sorry. During the accident, I was unsure if I was paralyzed or not. The doctor asked me if I could move my toes, and I remember not being able to. I don't remember much from the hospital because I was on so many pain meds. Oh my gosh. So when I was in the hospital, I don't remember much because they had IV pain medications, and I believe it was Percocets and it was Dilaudid. And they couldn't really do surgery on me because the bones are shattered. You can't really put pins and needles into anything. And so they stuck me in a back brace and then tried physical therapy. So I was in the hospital for 2 weeks on the dot. The day I got released, I quit taking pain medication. And I went to my regular doctor visits, and at one point in time, and I told my doctor that I didn't want any pain pills. And I went in one time with 12 bottles of 90 Percocets and said, this is why people become drug addicts.
But she has chosen another path in her life. When she was at a better place, what she wanted to do is to give back to the community, and that's why she became a community health worker.
It's easy to get into the drug addiction. Some of these people, they didn't have the same experiences that I did, and now they're in this position and they just feel stuck. They feel like they have to continue doing the same cycle. As a community health worker, I'm here to tell them and to help them to get out of that and to become the best person that they can be.
I feel really grateful to be able to see how she performs with the clients and to see how is genuinely a person that is down to the ground, helping others, you know, and just wanting to help.
If I didn't have the proper friends or family to help me through this experience, I wouldn't be in the position that I'm in. It's very hard to experience some things and then not feel empathetic towards some people. Like, I can try to help you do the best thing possible to get you off of those pain meds and to get you to be the best person that you can be.
Well, food's a big issue whenever it comes to getting old, especially when I think I don't eat breakfast when I should. I may skip a meal. Sometimes it's hard to make sure you got what you need. And as we get older, it's just something we have to consider. We've got a bountiful country, and food is a problem in a lot of people, not just in the rural area, but also in the city. Kids that needs food. We raise enough food to feed the world, but still at the same time, we got kids that go hungry. We got families that don't have enough food to put on the table. It's just a good thing that some of the kids get fed at school, or they probably wouldn't have nothing. It's just hard to understand that there's that problem in the United States.
It's gonna be cold like this for several days. I know, it's gonna be crazy. I hope there's a nice hot meal in here for them. Yeah, there is. Something hearty. Here are my bags, hot and cold. And I'm gonna take them their lunch. And I like to take it within a certain time frame too. Like the same time I take it every Friday. I like to keep that consistency so they'll be expecting it.
If we were looking at the top needs that our community health workers serve in the community, it would really encompass some things that you see nationwide and across the state and across our region as well. And the first one would be food insecurity. It remains a priority, even past the pandemic, that people are really struggling to get the food that they need.
I've been delivering these meals for almost a year. I enjoy it. I love the way they indicate on here just who gets what, because they have some of them have special diets. You don't want to get that mixed up.
When clients talk to community health workers about acquiring food, community health workers can connect those clients to pantries. They can connect the clients to churches or organizations that are providing a hot meal right in a specific moment. The community health workers are going to be listening carefully to the clients and the restrictions that they might have with their food, and so they can better connect those clients to the resources that they need.
Everyone deserves to have a meal. It should be their right as a human being. Thank you so much. Have a great week and enjoy your lunch.
I do. I will, and thank you.
You're welcome. What got me here to this position as community health worker was my mother. My mother lives in Florida, where I'm from. Excuse me.
Felicia Cunningham is our community health worker in Topeka, Kansas. So Felicia moved into Kansas and she started to work with different organizations trying to help the community.
Prior to this role, what I would do is work with parents, single parents, and their children to ensure that they had everything they needed for resources as well. Mostly like formula, different things for newborns and things of that nature. And also I taught parenting classes as well. So I facilitated classes to those that are in rehab, drug addictions, a variety of different clients that I work with in the community, because the theme they had in common, they loved their children, even though they were struggling. They did. And it's possible for someone to do that. Most of them, their challenge was that no one believed them, that they didn't care. But I believed them, and I cared.
And I know that they care too.
Felicia comes from a background where she's close to her family. I will say that Felicia has that in her still. She has that pain, but the way that she channels that pain is by helping others in the community and sometimes identifying those clients like if they were her mom.
My mom had been sick since I was here, since I came here in 2017. And I didn't know to what extent because she wasn't the type to share that details because she didn't want to bother anyone. That's what she'd always say. But since being here, she ended up having a bag of medications, a Ziploc bag of medications, about 20 pills, 10 different bottles. And I was here during the time when my siblings called me to tell me that she was in the hospital. And initially I told because I was in this role, and I'm glad I was, I told them my siblings, to reach out to other nonprofits for resources to help her, whether it was someone sitting at her side to help her manage her medication, make sure she eats properly or whatever it was, just check in on her, do safety checks like what I do here for my clients, which I think is so important. Just random call them and say, hey, how are you doing? Can I come over? That kind of thing. I would do that for my mother. She ended up with COVID. She had high blood pressure because of it. And everything just got out of control. I'm sorry. Sorry.
Great job.
Can I get up?
Yeah.
Okay.
Sure.
So, long story short, my mom got into a really bad situation, and they had resuscitated her twice overnight. And on that final, I got a call from my sister, who was responsible at the time to make the call, to make the comment to the doctors to tell them that resuscitate her, do not. She couldn't do it because it was so much on her at the time, a lot of pressure. She was by herself. So she asked me, what should I do? And I didn't want to, because my mom is all we had. We didn't know who our fathers were in our lives at the time. So I told them, do not resuscitate. I didn't cry because I would have upset my sister even more. She was by herself. So I did. And that's why I do this job, because I want to be with other people's moms. I couldn't walk beside my own, so I want to walk beside theirs and do everything I can to make sure they have what they need every day. This is a hard job. It's a hard job. It's not hard, just hard.
The ultimate vision for community health workers, I think we're seeing a lot of it come to fruition even just after a few years. This value that is reflected of their role in every service that exists clinically, and outreach and community engagement.
Having that path to have people trained, to have people with the knowledge about community health workers, and community health workers embedded in care teams, where you have doctors, you have social workers, you have nurses, you have community health workers being part of those teams all around that client.
And for providers, I think it's tough to imagine a world where CHWs don't exist once they have them, because they can focus on providing care, and community health workers can help patients better navigate the system and make practices work better.
This is healthcare the way it should be. I mean, I think our clinic runs because of our community health workers, to be honest. There's a lot of stuff that I do that's because of the work that they do behind the scenes.
For individuals that are in the community struggling with the social determinants of health, to let them know that they are not alone, because community health workers are there. I encourage you to look for them and get the help that you need.
Reach out to somebody, reach out. And if you might not reach out to the right person at first, reach out again to somebody else.
They're there. There always seems to be there. There's somebody there to help you out. And I just happen to get one of the best ones.
What keeps me going is definitely the feeling that, as cliche as it sounds, like it doesn't seem like work. It really doesn't, because I enjoy it. I enjoy building relationships with the families I help, with individuals I help. I enjoy being that trusted individual that they can turn to when they need help, when they're confused. And once they talk to me, they're like, oh, okay, never mind, I figure it out. So just being that security blanket for somebody else, it feels really good. It feels like you're needed, like they value you, and I value them, because at the end of the day, that's what my career is helping other people, and I don't think I could do another job.
I would have never got into the regimen of taking my pills and doing the things that I needed to do to stay alive like I have and thrive, not just stay alive, but become healthy again and just show me how to do the things that I need to do and be there for me to get me to where I need to be, to where I can grow, to become a better person in society, like I owe her everything.
And she really did a great job. She's good at her job.
And quite frankly, we need more community health workers.
There's not enough Casey's in the world right now.
I'm 51 years old. It's time to start somewhere. It ain't never too late, but you got to work. You have to put your foot in too to do the work. Everybody's not going to do it for you.
It's worth it. You start to make it, and you start to see the results, and you start to make friends at work, and and you start to feel like you're really needed where you are and appreciated, and it's just amazing.
So let's say that Felicia's not here right now. Mm-hmm. What would you say to Felicia after everything that she did for you?
Thank you. Thank you so much. Yeah, I'll probably cry.
What would you say to her right now?
I would say, Casey, thank you so much for everything that you've done.
Felisa is a lifesaver for me, for real.
See something?
Oh, I got to give her a hug. You have been an inspiration, I'm telling you. I'm telling you have. She's been a friend. I see in my future me having my own place, having a better relationship with my family, my grandkids, and hopefully keeping in touch with Felicia still. I'll still keep in touch with her. Yeah, I think this is a lifelong little friendship.
I really feel relief because I know that I can do these things now. I'm not just what I was stuck in. I can do things that other people do. I can have a home and a family, things like that. And I just am grateful for that. I feel loved, I guess, happy now, and appreciated.
It's good to have friends that we can lean on. They need to lean on us. We need to lean on them. They have needs just like I have needs, and we just need to lean on each other. Sometimes it feels like I'm doing most of the leaning. I do have worries, and worries kind of keep piling up as we get older. But I'm not giving up. There's people out there that are willing to help, they're willing to come by our side and be the support that we need. And I'm sure that there's help that's closer than we think.
All right, so that was the documentary, and we tried to capture as much as we could in terms of like social determinants of health and also community health workers. But I just wanted to give some room to Christina Bridges, Dr. Bridges, to give us some closing statements about like the great work that is being done at the health system with community health workers. So I'll pass it to you.
Thanks, Ton. Thank you for sharing that incredible documentary with us. I'm like almost on the edge of tears. So thank you. That was so amazing. That obviously demonstrates the impact, and then over here, doing research on outcomes from community health workers to kind of translate to healthcare systems and potentially to payers, why we need to fund this work, is that kind of work is a lot drier than what you just shared with us. But thanks for asking me to just say a few words. I'm involved in evaluation of a community health worker program here at KU Med. For primary care patients. And the program was spearheaded by Dr. Jennifer Woodward in primary care. And she asked the question really, can working with community health workers improve quality of care for our patients? And the other side of that is, can we improve our quality measures when we have, specific cohorts of patients work with community health workers? And so what we've done in primary care is sort of identify, which patients are falling in these big care gaps that are missing preventive screening and have poor chronic care management. And we identified that all these patients are within 5 zip codes in Wyandotte County. And so that's kind of this first cohort that we're looking at. And then they hired 2 full-time community health workers to reach out to those patients and work with them, do all the things that, you showed in this documentary. And so we're beginning now to look and to see, can we improve those care gaps? Are they coming in for more screenings? Are they having better care management? And can we save money that way so that the program can be paid for just based on, increasing our shared savings dollars through these value-based care programs. And then another cohort we're starting to look at is patients who have missed 3 or more appointments in 1 year, so have 3 no-show visits. Can we specifically reach out to those patients and get them to actually come in for visits and ultimately, can the healthcare system save money that way and put that money towards continuing programs like this? So we're just kind of starting this evaluation, but those are the kinds of outcomes I think that speak to, the clinics and the hospitals and the healthcare systems and potentially to payers. What's our return on investment in saving money in order to keep these programs going and hire more community health workers?
Christina, thank you so much for that. I think we are running out of time. I'm just going to pass it back to Jamie and Ashley. And I don't know if we have time for a question or if we got to the end of it.
No, thank you. I mean, definitely the impact with Dr. Bridges there and being blown away. That was fantastic. And I saw your message about, here in the future being able to maybe get access to a link for the full documentary. So we can definitely try to help spread the awareness there. We really appreciate all the efforts that you guys have been working on and presenting today at Research and Discovery Grand Rounds.
Thank you. Thank you so much. Christina Pacheco, thank you. Dr. Kessler And definitely, Dr. Ellerbeck, thank you for making the connection to make this happen. So thank you, everyone.
Great one.